leaders present, and professionals, doctors, and people in the healthcare space. Good morning. I think I joined David in saying this conversation we are having here this morning is probably the most emotional conversation we are going to have. And let me thank Professor for welcoming us to Catholic University. I also want to thank you for the appointment. I will supply my curriculum vitae and my certificates, because I think I qualify. As David has said, I have been around Kenya with my team, and there isn't a single meeting I have gone where there is, or in every single meeting I attended, including yesterday in Kilifi, you will find somebody with a picture of a loved one in some medical condition, and they are seeking for help. So this conversation we are having here, ladies and gentlemen, we are not having a conversation about politics. We are having a conversation about life. We are having a conversation about our loved ones, people we cherish and people we love. And therefore, when we decided that we are going to have a different format of engaging in the politics that go into the 2022 election, and we figured out that rather than sit in some boardroom and draft a manifesto, we better go to every county and listen to the issues that are important to the people of Kenya. And let me give you a personal experience. Last week, we had a persons living with disability forum, and they thoroughly educated us and changed my personal view. I thought I always knew. In fact, we had put in our proposal that we are going to increase the number of special schools to take care of the children that live with disability. And to us, it looked very nice, because we are providing additional facilities and additional schools. But they told us, no, we do not want more special schools. We want people living with disability to be integrated with other kids in schools. And that was fundamental. And they told us, the more we have segregated schools for people living with disability, the more they are stigmatized. And that completely changed our plan. And therefore, it validated our approach, that while we can sit somewhere and figure out what we think is not right, there is a wealth of experience, knowledge, and ideas out there that if we give ourselves time and provided a platform, we could actually tap into that wealth of knowledge and better inform what we want to do. That is precisely part of the reason why we are having this conversation about health. Ladies and gentlemen, the reason why we have listened to many health issues in many fora, in fact, in every fora that we have attended at the counties, matters health have always taken a prime place. Community health volunteers, lack of drugs in our dispensaries, no personnel in our dispensaries, challenges of procuring drugs, and it's been consistent. And that is why we decided that we're going to have one forum where we will discuss only health. I want to say the following as I sit down to listen to stakeholders in the health space. If there is a sector that suffers trickle down and needs a bottom up, is the health sector. Today, almost 60% of patients, instead of going to a dispensary or a health center or a level 3 or 4 hospital, they actually choose to go to referrals, because their experience is that there is no health professional at the dispensary. And if there is one by chance, there are no drugs. So if we must figure out how we are going to start at the bottom, how the health center, how the dispensary, how the community health worker is going to be empowered sufficiently to be able to deal with the challenge right at the root. If the dispensary is working, if the health center is working, it's the only way the level 4 and level 5 will work. As it is, the health center is not working because there are no drugs. The dispensary is not working because there are no personnel. And the level 4 and level 5 are not working because there is congestion. Everybody is crowded there. So, if there is one thing we must figure out from where I sit, you will tell us better. If there is one thing we must sort out, is we must take health to the bottom of the pyramid. If there is one other thing we must sort out, and again we are going to listen to you so that you tell us, we must sort out the health commodity supply chain. I don't know about the wisdom of having a monopoly called KEMSA. Some people must persuade us that there is logic, there is reason why we have a facility that don't have drugs that are required at the right time, but they have drugs that stay in the stores until they expire. We just simply must sort it out, right? And you go to any health facility, you go to any county, they will tell you they have very serious challenges with KEMSA. As chair of the IBEC, we even tried to say let the counties appoint 2 directors to KEMSA. They did about 2 years ago, but we are still on the same spot. The structure of supply of drugs simply needs to be redone. And finally, from where I sit, these are the 3 issues I wanted to say, is that we cannot continue to write on pieces of paper everywhere, and then the next day that piece of paper has disappeared. You come back to hospital, they write on another exercise book, and then it disappears. So health records become the biggest challenge and nightmare we ever have. I am aware that we wanted to procure a health records system, digital system, that would not only give us portability of patient data, but it would also help us in the whole space of telemedicine. But because of conflict of interest and other things, for 5 years, we have never managed to procure a health system. And therefore, if there is one urgent thing that must go into our 100-day delivery, is to figure out how to have a health system that will not only capture all the health data, it will also make patient data portable from one place to another without a lot of effort. And it will also make it that much more easy to sort out commodity supply and also help us with telemedicine. So good people, this is the conversation. This is what I think. You are better informed about this sector. I know we have people from different sectors of our health space with a lot of knowledge, with a wealth of experience. And this is the forum for us to have that conversation, because as you've heard, 30% of our population are one sickness away from poverty. And I think that's too much of a risk. We must do whatever it takes to sort out our health issues so that we can confidently speak to the words that a healthy nation is a wealthy nation. It's the only way we can take our economy to the next level. So, ladies and gentlemen, welcome to this conversation. I just thought I should, without necessarily directing what you have to say, but to also give you my personal experience from where I sit, and my personal experience as we went round with my colleagues here to various parts of the country. Karibuni sana. This is a very important conversation, and I agree with David that everybody should go away with a photograph to remind you that you are at the place where finally we sorted out the health challenges of our country. Asante sana.
Kindly, let's give our chief guest a better clap. Thank you very much. We will now move to the next session, where we are going to invite different leaders in the various sectors. And I will start with Mr. Simon Kingondu of the Kenya Medical Association, We will not have any specific order or priority because all of us, we want the best for this country, and therefore we are all equal in trying to share our thoughts in the health sector. And therefore I'll invite Mr. Simon Kingondu, after which we'll have Dr. Timothy Olwen of the Kenya Association of Private Hospitals, and then we'll have the third person, who is Mr. Tony Kirwa, who will represent the referral hospitals. Thank you. I'll kindly guide us. For those of us who are closer to the back door, the washrooms are ground floor, so you'll just get out, go to the ground floor. There are stairs on both sides.